Okay, so this is a brief demonstration on how to successfully treat a pathological low vessel. These are predominantly the longitudinal low vessels, and these are treated by bleeding. Now, of course, anytime you're going to be bleeding, you want to be gloved up. No, just kidding, not those. So you want to make sure you're wearing gloves. And what you're looking for are distended, darker veins. And these are an example of an excess low that has sprung into existence as a way to absorb the excess stagnant qi that comes from an unresolved, unprocessed, chronic emotional condition or state. Now, what you would do is really just like inspect the area of the sort of like the command level where the command points are. That's generally where you're going to be looking. Now, as you can see here, there's really no distended veins or spider nevi here. So I'm just going to show you how to treat. So, first, you're going to visually inspect the area for something that looks like a distended vein, a spider nevi, but not a varicose vein. So you don't bleed varicose veins because those are the valves that assist the circulation of the blood flow are already damaged. So, if you bleed those more, you can damage it further. But let's say, for example, like, this person is dealing with maybe a lot of fear, right? or anxiety, or stressed about like the uncertain future, and not just to the point where it's like mildly annoying, but to the point where it's a very even like low grade pervasive emotional state. And what you might see is either along somewhere like the kidney channel region or the bladder channel region, you might see like these sort of like distended veins that pop up. And so let's say we located one here. The easiest way to do that is to put on a plastic cup, right? And that draws a little bit, just with some light suction, and that draws the blood up to the surface to makes it easier to bleed. And then here we have these McKesson safety lancets. These are 17 gauge, I believe, 17 gauge. And so what you do is you twist the safety cap off, okay? And then the needle is way down in there. You can't see it. And whoop, see, there you go. So if there's a little bit of hair, sometimes it's harder to stick. You can use a smaller cup. Okay. But again, we're not doing full-on cupping. We're really just drawing some blood to the surface, right? And so once you feel that that's, give it about like a minute or two. It doesn't have to be long. Then you take that off and you put this over the area and press down and tap, right? And then you put the suction back on, right? Now, if you can see, it might be hard, maybe even getting it from this other angle. There's a tiny little dot there. So these safety lancets are pretty small. So what you can do if you want to get a little bit more out of it, and again, it's not bleeding much because there's no distended veins there. What you can do is you can sometimes use more than one. Just go like right next to it. Press down pretty firmly if it's, if the skin is a little bit elastic there. And then you can continue to draw some suction to the area, and that will draw that blood out. Now again, there's only a tiny amount coming out because there's no distended vein. If it was more of a distended vein, then you would get quite a bit of blood coming up into the cup. And then you would want to have like paper towels or tissues handy. So when you take off the cup, you can catch any blood flow. They also, you can get these, they also make these things called chucks, which are these blood absorbent pads that you can even put under here if you expect like quite a bit of blood loss. But again, you're only bringing out about like 10 to 12 drops of blood. If a patient is on blood thinners, If they're fairly hardy and their pulses are not excessively deficient, it's usually okay because, again, these lancets are so tiny, they're not really drawing a lot of blood out. And so generally with just a little bit of pressure and just like one tap, you know, to get about 10 to 12 drops of blood, the blood will coagulate. The blood will eventually stop. You could also get like this, what's called a blood stopping spray that you can get at either CVS or Rite Aid. There's a lot of places that sell this. You can get it pretty cheap online. It's a small vial. It will say blood stopping spray. So then basically you just take off the cup, right? Double check. You want to keep this here just in case there's any kind of dripping. And then just a little bit of pressure. And you're generally done. And that's it.